Hi, my name is Amy, and this is my insertion and discontinuing of an IV video. To start off with, I'm going to need my flush, a needle, which I'm going to do a 22 and 1 inch, tubing, extension tubing, gloves, and a IV starter kit. So to start off with, I'm going to go to the patient's room, close curtain, door, give them privacy, verify patient's name, date of birth, and then also go through the 6 rights to make sure I have the right patient, the right time, the right route, the right dose, and right documentation and medication. So I'll make sure I have all my rights. And then from here, I'm going to go ahead and do my hand hygiene, put my gloves on, and set up my IV extension tubing. Okay, and we're wanting to keep this as sterile as possible. So when we open it, we create that sterile field, and then we'll just grab our tubing here and pop off our flush, and we're just going to make sure there's no air bubbles in the line, and then set that back on, just that part on the sterile field. I can turn that down a little bit, and then go ahead and explain to the patient the procedure. So what we're going to do is start an IV. So we're going to go into your vein so you can get fluid or medication that way. So we'll just find our area that we want to go, and I am going to go ahead and open my kit here. If I can. And then once I find where I kind of want to go, I'm going to go ahead and just clean that area in a circular motion with my alcohol swab. And then place my tourniquet on. And I tie that on. And then also get my needle ready. And then at a 45, 15 degree angle, I'm gonna go right into the vein. Perfect. And I'm gonna look for a flash of blood, and that's how I'll know I'm in the vein. And from here, I can go ahead and take off the tourniquet. And once I hit that vein, we want to go in 1/4 of an inch just to make sure we're in there. And then from here, we can go ahead and just slide off our catheter and push in above so blood doesn't get in the way. Sorry, that's kind of harder to see. We can go ahead and retract the needle and put this in the sharps container and keep pressing here so none of the blood comes out. And then we can go ahead and attach our extension tubing on there. Let me just be careful because we don't want to pull it out or anything. Okay. And from here, we're going to just let them know we're going to push the fluid, that they may have like a burning sensation with the fluid going in. So just make sure they're doing okay. So we'll push that in. And we'll make sure it's going in smoothly, that nothing's coming out. And you can go ahead and just let that go. Perfect. And then once that's done, we're going to go ahead and clip it so no blood comes out. So we clip the tube in here, and then I can go ahead and detach this. And we're gonna just coil it up, make sure And from here we can go ahead and place the bandage on. In this case we're going to use Tegaderm. You want it to be see-through so you can still see everything. Perfect. Awesome. And then we would write the date, time, our initials, all on that so they know when we placed it. And then we would go and do our documentation, take off our gloves, perform our hand hygiene, dispose of everything. In this case, I'm just gonna write a few things here. Okay. Okay, and then for discontinuing the IV, we're gonna go ahead and perform our hand hygiene again, verify the patient, make sure we have privacy, go over the 6 rates again, and make sure that they are due to have the IV removed. Okay. And then from here, we're just going to explain that we're just going to remove it very slowly. It shouldn't be too painful or anything like that. So we'll go ahead and first start off with removing the bandage and get our gauze ready for when we take it out so we can put pressure on it. So we'll just slowly slip out the catheter, putting pressure. And we want to make sure that we look at the catheter, that nothing's broken off or anything like that, and that we have the full catheter, and go ahead and dispose of that. And continue to hold pressure, put a Band-Aid on if they need it. And otherwise, we'll go ahead and remove our gloves, wash our hands, and make sure the patient's stable, and do our documentation. And yeah, that's my video. Thank you.